Citizens of the world, I have some huge concerns on how Dutch health authorities are dealing with the outbreak in the Netherlands. Another thing I want to inform you all about is the COVID-19 mortality rate. In my previous video, I talked about the World Health Organization mortality rate estimate. I will talk about it again in this video, but I will show you that they have used the wrong formula to calculate the mortality rate during an outbreak. To start, I'm going to speak my concerns about 900 students from the Vindicat Student Association that went on a ski trip to northern Italy. They decided to come home early to take away people's concerns and arrive back in the Netherlands today instead of tomorrow. 760 students traveled back to the Netherlands by bus. The remaining 140 came back to the Netherlands with their own transportation. This morning, they all received instructions from Dutch health organization GGD Groningen in the bus. From what I have read on Dutch news websites, 4 students that traveled back to the Netherlands by bus are showing symptoms of the virus. Dutch health organization GGD Groningen is only testing the 4 symptomatic students, and they gave all students a flyer with information about COVID-19 and just sent them home. In this flyer, it says there is no risk of infecting their housemates because asymptomatic transmission is not possible. I really don't understand why Dutch authorities are so highly convinced that asymptomatic transmission is not possible, even though it has been proven a couple of times that asymptomatic transmission does happen. It might not happen all the time, but it's still possible. 4 students are being tested and the rest is just being sent home. It's highly irresponsible in my eyes. Groningen is one of the biggest student cities in the Netherlands. The chance that some of the students that just got back are asymptomatic and infecting others is pretty big, so why take the risk? I believe a big explosion of new infections in the Netherlands will happen due to this highly irresponsible action. The Dutch health organization RIVM has just informed the public that the 4 symptomatic students have tested negative for COVID-19. There is, however, a possibility that we are dealing with a false negative test result case here. Remember the woman from China who tested negative 8 times before finally being diagnosed with COVID-19? Because I do. There are a lot of stories about false negative test results, because in the early stage of infection, it's harder to diagnose COVID-19. In my previous video, I talked about World Health Organization Director General Tedros telling the world the global mortality rate of COVID-19 is 3.4%. However, I found out that the formula they used is wrong and inaccurate. They took the total number of confirmed cases and divided that by total deaths. However, according to the website Worldometers, this calculation is not accurate during an outbreak. To get a more accurate case fatality rate, we have to use this formula. Total deaths divided by total recovered plus deaths times 100 is CFR. When we do this, the CFR is currently 5.6% globally. A point of concern with this calculation is Italy's case fatality rate. It's 27.3% at the time of recording. Why is this a concern? Because 61% of all confirmed cases in Italy are hospitalized. That means a lot of those people might not make it out alive. Now, of course, these CFR numbers are going to change over time. More people will recover, but more people will die as well. Let's just hope the numbers go down instead of up. The Lancet Medical Journal published an article today that says the following. Evidence suggests that the colossal public health efforts of the Chinese government have saved thousands of lives. High-income countries, now facing their own outbreaks, must take recent risks and act more decisively. They must abandon their fears of negative short-term public and economic consequences that may follow from restricting public freedoms as part of more assertive infection control measures. So basically the Lancet is saying that Western countries should stop being reactive and start being proactive and take drastic measures to fight this outbreak, just like China did. That's what I've been saying from the start. 16 new confirmed cases in the Netherlands were reported today. That brings the total to 188. patients of which they have no idea how they got infected are increasing, and according to Dutch authorities, this indicates the start of an epidemic in the Netherlands. If you ask me, this epidemic has already begun. To me, it's also pretty logical that they are having trouble tracing back infection routes if they completely ignore asymptomatic transmissions. Reporting to you from Amsterdam. Give this video a thumbs up, subscribe to the channel, stay safe, and see you next time.